at that time, online classes were, I don't want to say new, but, of course, we didn't have this much technology. They were kind of clunky, I guess is the word. So we may have had an online component, but we would still, I guess now it'd be like a hybrid class. Like, we did some stuff online, but for the most part, we were doing things in person. So another important aspect of that program was teaching how to transition classes from an in-person format to an online or hybrid format, which is also some of the work that I do now. So I think those are the two main things. And then as well, the train the trainer aspect, which we know is really popular in public health. So using community health workers to train other people to do their jobs. So, I guess the biggest thing is just being able to, use your resources, because we know that, depending on what type of organization you work with, public health programs can be drastically underfunded. So you have to figure out how to make the most with the least a lot of the time. And I think train the trainer was something that I learned while I was in that program too.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 87. Hi everyone, Omari Richards here. Be sure to follow me on Instagram at DrPH Millennial. Be sure to subscribe to this or follow this podcast so you don't miss out on when episodes are released. I greatly hope that you all are sharing these episodes and giving them reviews, because that really helps the show get out to more people. So be sure to review and share if you have not as yet, and if you'd like to support, you can go to thephmillennial.com/support and find out different ways to support. I think there are also links in the description to support. But I really enjoyed today's guest. It was a great conversation. She was very insightful in a lot of things. I learned a lot of things, as well as I think her perspective on life could help a lot of other people with the MPH moving forward. And be sure to listen to the end, because I think there's some key insights in there, especially like if you're in your bachelor's or master's program. Definitely listen all the way to the end, because there's some great information. But I'm gonna stop talking because you guys hear me talk. But enjoy the episode. See you all next week. Today we have an experienced organization development and innovation consultant in the public health space. She got her Bachelors of Arts in Psychology at the University of Nevada, Las Vegas, then went on to get her Master of Education at the University of Nevada, Las Vegas. Then she went on to get her Doctor of Public Health at the Florida A&M University. She works as the CEO at Insight Consulting and Associates, LLC, as well as is a Data Analyst with the United Negro College Fund. We have Dr. Brittny James, DrPH, MED, CHES. Welcome to the show.
Thank you, Omari. Excited to be here with you.
As I am excited to hear more about your story and everything that you do in public health. So I'm glad to have you on. And I guess to that vein, how are you doing and how have you been coping during this pandemic?
So I guess I'm as good as anyone can be amidst the panini or the panorama, whatever we calling it today. Been coping pretty well, working from home mostly. So, still been trying to stay social. I just told you I was working at a co-working space, at least to be able to get out of the house and see other adults. So, I know we have to be kind of creative amidst all of this, but doing pretty well overall.
Yeah, absolutely. Well, I'm glad that you're doing well as having that co-working space where you do get some of that like community or just meeting people and getting that interaction that we all have kind of been starved of over the last 2 years. So how do you identify, and then tell us a little bit about your personal background?
Sure. Well, I know you just gave an introduction, but again, my name is Brittny James. My pronouns are she, her, and hers. A little bit of my background, like Omar said, I'm a Las Vegas native. So I went to undergrad. I started out at Fisk University, actually. And then I went on to UNLV, which is where I got my undergrad and my master's degree. And then I went to Florida A&M in the College of Pharmacy and Institute of Public Health, where I got my DrPH as well. During that time, I took the exam for the Certified Health Education Specialist. So I retained that designation, through continuing education credits every year. You have to, re-up it, but I've been doing that. I'm planning on taking the CHES maybe at some point next year. We'll see. The pandemic has been difficult, but I think it brought about some blessings for me professionally. Prior to the pandemic, I was working full-time at UNCS as a data analyst. We went home during the pandemic, and somehow I also got a job offer amidst the pandemic as well. So I actually started and designed the Bachelor of Science in Health Science program at Georgia Gwinnett College. So I was the department chair there for just about a year. And then they wanted people to come back to the office. I wanted to renegotiate my salary and my contract. They didn't want to give me what I wanted, so I left. And that's when I started working for myself full-time as a consultant, which has been amazing. I've been able to learn quite a bit. I mean, it's a huge pivot from working full-time, but I mean, even amidst always having a full-time job, I've, been a hustler. So it's not like it's been too difficult trying to navigate this space as a consultant or doing contract work because, it's basically relationship building, which I've been doing my whole career. So it's been an experience. And overall, I'm grateful for it. Really glad to be kind of out of the permanent academic space, but creating my own way.
Yeah, absolutely, fair enough. And thank you for that overview. Definitely gives us some perspective going forward into your story and here. And I'm definitely going to ask you more about that renegotiation part and how it didn't work out for you, because I think that in itself is a strength to be able to say, okay, this is what I want, this is what I'm with, and them not agreeing with that, and you parting your ways and starting this consulting business. But we'll get into that a little bit later on.
Okay.
So before we hop into your story, what does public health mean to you?
I actually grew up in public health. My mom is retiring in January, and she's worked in several administrative functions at the Southern Nevada Health District in Vegas. So growing up, I would always be at, whatever their awards events are, or if they had any community events, I was surrounded. I just didn't know at the time what it was that I was doing. When I was getting my undergrad degree in psychology, my senior year, I did like a research assistantship where I was working with grad students who were in the PhD in psych program to collect some data. So from there, I was able to really learn about just being immersed in community and collecting data. So for me, that was my first real introduction to it as a researcher. So from there, I, created these various experiences. But I mean, overall, public health to me means community and doing things for the betterment of the community at large. So when we think about medicine, you go to the doctor and it's about what's going on with you at that time in that moment. But when we think about community health and public health, we want to make changes that are going to have long-term implications for the most amount of people possible.
Yeah, absolutely. And I like how you describe that, because it describes it in a way that like medicine is a lot more reactionary, like this is happening, let's do this. And
Sure.
Public health has to be more proactive in the sense that let's get these systems and things in place to ensure that the most amount of people are able to get the best opportunity at health in whatever sphere that is in. So I appreciate that. So then you got your Bachelors of Arts in Psychology at the University of Nevada, Las Vegas, but you said that you started off at Fisk University. So tell me about that thought process of going to school.
Well, I went back and forth. So my freshman year, I stayed at home. I went to UNLV. I stayed on campus my first year. And that was because I was 17. So I couldn't I guess for me, it didn't really make sense for me to go anywhere yet because I couldn't really do too much. So my freshman year, I stayed home. And at that time, I was applying to HBCUs. I knew I wanted to go to HBCU. I only applied there. Fisk is where I got the most scholarship funding. So I went there my sophomore and junior year. And I just went at and right. So I had to go home and get myself together. So I came back my senior year, and that's when I took the GRE and was getting prepared for grad school. At the time, I thought my idea was to get a PhD in psychology. Quickly realized that requires a master's degree. Well, most of the time, a master's degree in psych, plus I wanted to diversify my resume, which I think we're going to talk about that a little bit later. But when I say that, and I tell students all the time, like, you know, you get an undergrad degree in psych and then a master's degree in psych and then a PhD in psych, and that's the only thing you can ever do. Granted, the skills are probably transferable. You want to be able to diversify the organizations and different types of people that you're working with. So for me, I applied to a few master's programs in psych and psych, public health, health promotion type work. And I ended up staying at UNLV because I got a scholarship that would allow me to go the 2 years for free, as well as get a stipend. I was working with my major professor at the time, who taught at FAMU prior to that, and she recommended the program, the DrPH program. So I applied at FAMU, Georgia Southern, and St. Louis University. So I didn't get into St. Louis University. That was my first letter back, and it was a no. And then I got accepted at Georgia Southern and FAMU like the same day. Georgia Southern offered a fellowship, but I don't know if you have ever been to Statesboro. It was terrible. It was just white people in Walmart. So I was like, this is never gonna work. And I went to FAM to visit. My best friend came with me, and I was in the parking lot, and Dr. Harris, who is the director of the Institute of Public Health, saw me and like gave me a full tour. I got to meet people, and I was like, okay, I'm coming. So that was June. I was in Tallahassee by July 25th. So that's kind of how I got into it.
Okay, awesome. Well, thank you for sharing that as well. That also helps in like thinking through how all of this worked. So my first question is, when you were starting university in Fisk University, or no, you started at University of Nevada, Las Vegas, UNLV, is that what you call it? Is that what we call it?
UNLV.
All right, UNLV. So did you go in there as a psych major?
Yes.
Yeah.
I started as a psych major. Well, I might have lied. It's been a while. I think I started as something science, like pre-med-ish, because when I went to Fisk, I was still in pre-med, and then I had Dr. Priscilla Evans Morris for organic psych, and I was like, yeah, this is not for me. I actually did an internship the summer after my sophomore year at Washington University in St. Louis, and it was more medicine based, and I didn't like it. It was more like lab work, and I'm like, this ain't for me. What else can I do? So from there, I just talked to my advisor about my options, went to psychology. So I started my psych courses like my junior year.
Okay.
And went ahead and finished in that program. So I did switch one time.
Okay. Well, thank you for sharing that as well. And you said that, so you said that you wanted to do research, but then you also at that same point in time, you went into that internship at Wash U St. Louis, and that wasn't the type of research that you wanted to do. How did you know what type of research you wanted to do?
I think that's the thing, like you don't know. I mean, I think depends on how you grew up. You know, my parents didn't go to college, so like they weren't able to give me any insight on what it's like to be a researcher or anything like that. That was my first real experience, other than having talked to other professors at Fisk who were doing research. So I knew sort of the process of it. I think at that point I had already taken a research methods course maybe. So I knew what it was about, but I think like the lab work just wasn't what I wanted to do. So I was working on a genome sequencing project, which it was really cool. It was just the tasks to me were like a bit monotonous. So even though now, retrospect, I know that I would have been the one who, you know, was planning the study and, you know, creating those different roles, like I would never be at a bench in this position. But still, I mean, there was just a lot of steps to it that I thought it was boring. To be honest. So I prefer, you know, to work with people, and I think being able to get more immediate gratification from what it is that I'm doing. So I feel like, you know, in that experience, I was doing the work of genome sequencing, but you don't see the effects of that for like years and years or long after you're dead, and people have done extensive work with your data. But, you know, when you're doing community work, you can, you know, from 9 a.m. to 12 p.m., it's a whole different vibe at 12 than it was at 9. So, I think being able to really see the effects of your work is important, especially for Black researchers when we're working in Black communities. Like, we really want to see how people are responding to the work in real time, and not whether or not they're going to pick up a journal and understand anything about genetics. That's not as important as understanding how to adequately feed your family. You can learn that in an hour.
Yeah, absolutely, fair enough. And I also think it's good that you highlighted that even though the research like on genomics and whatever not is monotonous, there are other roles in that research space that you would have been willing to do more so, like the PI type person who's like setting up and organizing the project rather so than the person that's actually carrying out the monotonous experiment type stuff. And then earlier you also said that, because for me specifically, I know during my undergrad, I didn't really realize that community-based research was a type of research that people did and stuff. And I know earlier on you mentioned that you had interactions with PhD students. Was that during your undergrad that you got that interaction?
Yeah, that was my senior year. And I was working with, actually, it was maybe 3 or 4 students who were in that PhD lab at the time. And they were collecting data on minority students who were habitually truant for school, middle and high schoolers. So we would go to the county court where if you've been, let's say, marked as truant for more than a month, your parents have to come to court with you. So participating in our study counted as part of the community service hours if they were granted them. So let's say you're a student, you and your parent come and they say, all right, you've been late too many times for school. You have to go back to school immediately and complete 20 hours of community service. They got like five or so hours from us for participating in our study. And I'm trying to recall the survey, but it was basically a survey to the parents and a survey to the students, just asking about their home environment and what they think might be keeping them from wanting to go to school. And this was mostly they were mostly Hispanic students, and that was by nature of the schools that they chose to participate in the study. So again, now that I'm on the other side of that, I'm sure that was purposeful for some reason. So that's kind of how I got into it. And now all of the students that I worked with at that time, one is, she has a PhD in psychology. She is a practicing psychologist. The other she finished her PhD, but she also went to law school. The other 2 also finished their PhDs and are in professor roles. So they stayed in that arena, and that was more than 10 years ago. And we still keep in touch.
Yeah, and I think it's also important to highlight just like those interactions of exposure to this type of work is so important for us to know like what we can do and what we're passionate about and how we can integrate like what we like into the work that we do going forward. So thanks for highlighting that as well. So you went on and got your Master's of Education at the University of Nevada, Las Vegas. But before we get to that, did you have any other takeaways that you wanted to share from undergrad?
Sure. I think a major takeaway was like being involved. Even when I was at Fisk, I was involved quite a bit. And I mean, you just have to, I think the biggest thing is like always thinking about increasing your network. Anybody you come in contact with is part of your network. So the more organizations you participate in, the more you're involved, the more, events you go to, that was really big for me just in terms of, I think, personal growth. And even when I was at Fisk, I was president of an organization. It was called Women of Perfection. And what we did was mentor students from one of the local Nashville high schools. 15 years later, one of the students from my program is my husband's line brother. Just a small world, but I said that to say your network is so important and the impressions that you make on people are critical. So I think from undergrad, I guess if I could go back and change anything, I probably would have, I definitely for sure would have stayed at Fisk, but hindsight as well, staying at UNLV got me that research opportunity. So, you just never know. But, I think the biggest takeaway is just always keeping in mind that someone is watching you and someone's going to know you and remember you. And, you're always representing yourself in whatever it is that you're doing.
Yeah, absolutely. I think like to that point of like building that network is building your brand. Like who do people like, what do people think of when they think of you? Like what kind of character
Correct.
are they going to ask you to help out in these circumstances and things like that? And yeah, that's all important things for people to develop and understand. And as you said,
Hmm.
get involved because you never know who's looking, you never know what those relationships are going to turn into in the future or who can help you and all that good stuff. So it's hugely important. Um,
Definitely.
yeah. So tell me about the process. So you got your bachelor's of psych, and then you did you know you wanted to get your master's, or how was that? And then why masters of education?
Yeah, so I think I mentioned not being really sure about the PhD. I think I knew I wanted to get one because I've been so heavily influenced by the young ladies that I was working with in my research experience. So I knew I did want to get a doctorate. I think once I was finishing school, I wasn't sure exactly in what. The MED program is in health promotion. So it actually doesn't exist anymore. It's an MPH program, but this was before MPHs were cool. So that program was the first one in the School of Community Health Sciences, which is now the School of Public Health. So at that time, now my degree, I guess, is kind of outdated because essentially it's the same curriculum as the MPH. Like when I was finishing, they were bringing in their first set of students who were signed up technically under the MPH, and I think they ended up phasing my program out maybe a year or two later. So I guess technically I could go back and ask them like if I could be granted an MPH. But I will say I think that the MED curriculum was a little bit different and that it had like pedagogy embedded in it. So I had classes from the School of Education as well. So I did learn about actual teaching strategies. So I think the goal for that program is to train people who go into direct community health work, like being able to design curriculums and things like that, which I do now, just in a different capacity.
Okay, that's awesome. And yeah, I'm guessing that a lot of the work that we consider MPH now, or the degree that we consider MPH now, has been taken upon by Masters of Education with like that concentration on health promotion or like community health or even like
Yep.
even like family planning and stuff, which might be more like
Yep.
social services, but also relate to the public health in a lot of senses. So
Mm-hmm.
that makes a lot of sense. So you're getting this degree. Actually, what was some of those, if you remember, what were some of those teaching strategies that you thought were important or pivotal, like in the work that you do to this day?
Oh, that's a great question. I think some of the strategies, one is just being organized. I think that's critical to to teaching. And just instruction in general. And if anybody has ever developed a course, you know how important it is to be organized and plan ahead. So I think the best part of that program was being able to create courses. So we were able to create like our own, like dream up a class and create it. So we were able to develop our own courses, like from front to back with like syllabus, course assignments, understand rubrics, grading. At that time, online classes were, I don't want to say new, but of course, we didn't have this much technology. They were kind of clunky, I guess is the word. So we may have had an online component, but we would still, I guess now it'd be like a hybrid class. Like we did some stuff online, but for the most part, we were doing things in person. So another important aspect of that program was teaching how to transition classes from an in-person format to an online or hybrid format, which is also some of the work that I do now. So I think those are the two main things. And then as well, the train the trainer aspect, which we know is really popular in public health. So using community health workers to train other people to do their jobs. So, I guess the biggest thing is just being able to, use your resources because, we know that, depending on what type of organization you work with, public health programs can be drastically underfunded. So you have to figure out how to make the most with the least a lot of the time. And I think train the trainer was something that I learned while I was in that program too.
Okay. Yeah, those are like fundamental and heavily used in public health in a bunch of different
Mm-hmm.
circumstances. And then also during your time in your MED program, you were assistant manager at Abercrombie and Fitch Company. Do you want to talk a little bit about that experience?
I mean, no. I mean, I was a retail manager. All you needed was a bachelor's degree. I actually was already working at well, I was working at Hollister. My senior year, I had got a part-time job there. So when I graduated, I got a promotion and I was an assistant manager. I mean, it's not much to say about it. I also worked part-time at a restaurant. So I was a server, which I think really taught me how to multitask. It was a busy restaurant. Taught me how to multitask, which has, a lot of these skills were highly transferable, which I know we'll, again, get to that. But it was really important for me at that time, not really knowing what I was going to do next because I wasn't 1,000% sure about the PhD or where I would be going. Where I'd be going, where I was going to be working, that type of thing. So it was important for me to gain skills and not really focus or care too much about where I was working at, rather what skills am I going to be learning in this position. So yeah, that said, I mean, there's not really much to say about Hollister. It was a cool job. I met some cool people, but
Yeah, that's absolutely
that's
fair.
it.
And I think like to that point of you saying that, like some people might be in jobs where they don't think it's necessarily public health related, but how do you like build those skill sets that you can transfer and talk to in public health schools or
Absolutely.
public health applications or like job applications and all that kind of stuff is hugely
Mm-hmm.
important. So thanks for sharing that insight.
Mm-hmm.
And then did you have any other takeaways from your MED program?
Again, staying engaged. If I hadn't, had that research, I was a research assistant my whole time. And I think if I hadn't had that experience, I wouldn't have been able to, again, understand like creating research processes. I was part of the team that, wrote the grant for my program. So that allowed me to continue to work with that professor probably like 3 years into my PhD because I had already been, a part of the original team. So anytime there was funding for a consultant or some contract work, they allowed me to do it. Not allowed me to do it. I could do it. So I was able to, always have, a little extra check here and there from working with them whenever there was, like an evaluation project, I would lead that. Or if they were doing some data analysis, I would do that. Any writing projects that came up doing that. So I mean, I think again, and that professor and I are still really good friends. So I think again, it's just taking advantage of the opportunities that come up. I had a classmate at the same time who she was offered the same opportunity and said no, like she thought it was too much work, she didn't want to do it, and okay, I didn't know her that well to talk her into it or not. She's actually since passed away. It was really sad, but she ended up going into a PhD program. But I remember speaking with her, and she just felt so unprepared going into that PhD program, whereas I think I felt really confident because I had already done, at that point, I had worked on 2 or 3 different studies. So I knew more about the process and especially the administrative functions of doing it, which you don't really learn about from research articles and things like that. So again, staying engaged, creating positive relationships. I mean, I think that's always the mission.
Yeah, and I like that a lot because even in the experiences that might be too much or like you might perceive as too much, you're gaining skills and understanding, as well as like you said, you felt more confident going into your PhD program as opposed to who didn't take on that opportunity and didn't get to learn those skills. As well as I feel like in public health, there's a lot of like just generally a lot of administrative things you do, whether that's hosting meetings, writing up minutes and things like that. And we don't get that kind of training in school a lot of the time. So seeking out those types of opportunities are very important as well.
Mm-hmm.
So you got your doctors of public health at Florida A&M, but when did you hear about public health? Was that during your bachelor? Was that during your MED program? When did public health come up?
No, like I said, my whole life, because that's what my mom did. So I've always known what it was and what it was about. I originally I liked the administrative side more, and I think I still do. So when I was in my MED, my concentration was healthcare administration. So I learned, I learned more like the budgeting aspects, HR functions, stuff like that. So I mean, I'm still very much into that, but that was my concentration. But I've known about public health like my whole life. I've always known what it was my whole life.
Yeah, I should remember you said that. Okay, but then next question now. So you said that you weren't fully sure on getting your PhD. You weren't 100% sure on that. Or
Mm-hmm.
and you didn't get your PhD, you got your doctor PH, doctor of public health. So what was
Mm-hmm.
that thought process, and what got you like more excited or more sure to want to pursue this terminal degree?
It was a logical next step. I had already done enough coursework to get into a program and get out within 4 years. And I mean, at that point, I was, comfortable with the idea and moving. And the biggest thing is that at the time, I was interning at the health department where my mom worked at. Of course, it's a huge organization, but they had a nepotism clause, and that would not allow me to work there at all, like in a paid capacity. So at the time, that even now still, to my understanding, that's the only major public health entity in Vegas, unless I worked at the college. So I mean, as far as work options were a little bit limited by staying home. So I mean, that kind of wasn't an option for me. So I just had to kind of explore what else was out there. Like I said, that made sense, especially given I had already been participating in research, and like I felt comfortable with that. So for me, and I think just in general, I mean, there's not a lot of difference between the DrPH and PhD in public health, if anything at all, to be honest, other than the name. I think it was intended to be more of a practice-based degree, and I think a lot of schools have taken on that approach of having a longer, like let's say practicum or something, instead of a dissertation, which makes sense, or not requiring as much from the dissertation process as a PhD program might. Like, for example, I know some DrPH programs allow you to use secondary data, whereas the PhD program may require that you collect your own, so that they can show the process. You can show that you know the process of starting and creating a study. At FAM, we collect. Well, my program, we collected our own data, but you had the option if you wanted to use secondary. But we also had I forget I think it's called a practicum. We had that as part of it too, and it had to relate to your study. So at the time, for me, it wasn't like PhD versus DrPH. It was more so just selecting a school. And like I said, I only applied to 3, and just, put my stock into, I retook the GRE, got better scores. At that point, I was able to speak more about my understanding of, research and what I would do beyond that, which, I was always interested in academia. I knew that would be a good fit for me, but even now, I'm to the point where I know I definitely need to be in administration. Like I won't go back to academia unless I'm like a dean or something like that. So I do know that, but you have to get in it to know. We don't come from generations of, a family full of professors that can talk to you about that or prepare you. So that kind of has, placed me in a really unique position to be able to train other people coming out of, especially HBCUs and minority serving institutions, like to be more prepared for faculty roles, because we just don't know.
Yeah, I love that. And I'm going to ask a question about the academic versus administrative a little bit later on when we get more towards your Georgia Gwinnett College experience.
Okay.
But going into your Doctor of Public Health, did you have to like choose what you were going to study or what your practicum was going to be, or what was that thought process, and what did you do around that?
So that process, it was already defined by the school. So after you finish your coursework, so that was 2 years. Once you finish that, yes, you have to select your own topic. And from there, you have to select a practicum that relates to your studies. So for me, I was exploring physical activity among Black women who were in sorority grad chapters, so alumni chapters of Black sororities. So for my practicum, and I surveyed women from all 4 Black sororities. For my practicum, I did sort of like a shadow with the president, or not, I'm sorry, she was the president, but as well, she was over the health committee for Sigma Gamma Rho, the chapter that's in Tallahassee. So I sort of shadowed her to get an understanding of, one, because they're the smallest organization and they have a little bit more say over their local programs. This is just my experience being an AKA. I know we're a little bit more farther removed from international decisions. But I worked with her to understand, one, how their international programs are developed and how they translate those into the community. Not just that, but how do you encourage your members to also take care of themselves? Because that was basically the premise of the project, is like, you know, you get in a sorority and you're supposed to do all this service for other people, but how are you taking care of yourself? As well, these are women who are college educated. So I wanted to know, essentially, does your book smart relate to your health smart? So I asked women about their knowledge of physical health recommendations and then their actual participation in them. So I would find that Black women either didn't know the recommendations, or the ones who did still chose not to do activities to meet them. So that's kind of the question, is like, well, you know, if the premise of your organization is to serve others, how can you do that if you're not serving yourself? So, you know, I've had some really good at least thoughts about how that information could be used, especially for these organizations, like being sure that you have something internal that, you know, maybe is a buddy system where people can walk together or, you know, be accountable towards each other. But we created our practicums based off whatever your proposal was. And at that point, your concept, so like the idea of your paper, has to already be accepted. So from there, it's kind of like, I know what I'm doing. The practicum is meant to sort of fill the gap in your personal knowledge about the topic. So you can create practicum however you want it to. So again, going back to having strong administrative skills, I was able to, like, I created my own, not just like a timesheet, but I created measurable objectives for what I would gain working with this chapter over these, I think it was like 3 or 4 months. It was a semester. So I had measurable objectives of what I was supposed to do. I attended all of their health related events. I had to teach 2 classes. Like, you know, I had stuff embedded within that so that it wouldn't just be, you know, this lady signing off that I did something. I actually got a lot out of it. And again, that's another relationship that has remained in my life. So, you know, a lot of the women that I know from that experience are still friends of mine today.
Okay. And that's really cool. And I think, like, just highlighting that in a lot of people that save other people, understanding that you can't pour from an empty cup. And a lot of the times we're trying to tell people to do things without actually taking the steps in our lives to, like, ensure that we are taking care of our health as best as we can, so that we can give the most and the best for our whoever we're trying to save or whatever community that is. So that's definitely very interesting work that you did there as well. Mm-hmm. Did you have any other takeaways during your DrPH?
I mean, I guess it depends on what your goal is. Like I said, I knew I wanted to be in academia, so I was also a research assistant or a teaching assistant for one of the faculty that was in the College of Pharmacy. So that allowed me to teach a couple of classes while I was in school, you know, gain some experience there. Doing so, I was able to get a adjunct position at the community college in Tallahassee, which I just stopped teaching there last year. I stayed there for like 8 or 9 years, teaching part-time. I started in person and then I shifted to online at some point along that journey. But I think the biggest takeaway is you know, I know you can't know for sure exactly what you want to do, but I think it's really important to go into your PhD program with an end goal. Like, I knew I wanted to be in academia in some aspect. I wasn't sure if it would be like, you know, the normal assistant associate trajectory, but I knew I wanted to be involved in, one, teaching or preparing people how to teach, as well as decision making for students. So I didn't know exactly what that would look like, but I knew I had to get some experience in teaching. So I think it's really important that you try to, talk to as many people as you can about what it is that you do, so you can, one, identify what your strengths are, and two, see what it is that you like to do and gain some experience doing that. Because there's a lot of people that come out with their PhD and they don't have no experience. So you still can't really get a job, you still aren't technically qualified for anything. So you need to be able to, piece all of these experiences together. So, I mean, it was always a running joke, like, of my friends, that I always had like 2 or 3 jobs, but I'm able to mold myself to fit whatever position that I'm interested in at the same time. So, for our parents and generations before us, they retire. They stay in jobs forever. For us, it's not really like that. You gain some experience, network, and move on. And I think that's really important for people to know, that like those days of sitting in jobs for all of these years is not required. And never have I been asked about like, oh, you're only at this job for, however long, what happened? Like, that's never been a question that anybody's asked. So it's more so focusing on building these skills that are transferable that you can do in any organization. So, I mean, I could work at Cartoon Network if I wanted to in communications, because I've done that kind of work. So you just need to kind of think more big picture, instead of like narrowing down like, oh, I want to work in HIV communication. Like, that's such a specific thing, and not every organization is going to have that. So if you just back up and say, okay, I want to work in, or I want to gain some experience in HR communication, that still allows you to be able to work in any organization. Everybody has an HR department. And as well, most people, and if they're not, you can offer to build an employee resource or employee engagement group around health within that department. So I think it's just kind of taking a step back, instead of, us really being focused on like, what am I going to be when I grow up? It's more so like, what kind of skills am I interested in, and what do I like doing? That was a long answer, but I think it was helpful.
Yeah, definitely like that, because I feel like especially people in the MPH, like just in general, students in general, they want to be specific about this one thing or this one topic or something like that. But as you said, focusing on the skill sets and the experiences, and being able to take more experiences so that you're able to talk to those different experiences in different types of ways, and just like the intersection of them and how that all builds up to one better skill set, and helping you get those jobs in different ways. And I think that's important, especially considering that public health is a very broad field, and it is not easy to get into like very specific rules, especially like specific topic knowledge rules. So knowing that and approaching that with that kind of lens is very important, I think, for students to really understand, and especially if you're in like a PhD or DrPH, and really like advocating to build those skills and experiences outside of what you're just doing with that degree. So thank you for sharing that. Yeah. And then you graduated from your DrPH program, and I see that you were an adjunct professor at Tallahassee Community College for 8 years. So, and I think you were both for 8 years. How did you get this job after graduating?
No, I got that job while I was in school. So that's the part-time position that I mentioned, teaching. And I was able to get that because I had been a teaching assistant already at Sam, and one of the girls that I was working with in my research group at Florida State during my first year, she was working at TCC and she was about to graduate. So I pretty much got her job after she left. So it was a part-time position. So that was always like my part-time role. When I first graduated, this is why I don't like LinkedIn, because it doesn't really give you the right picture. So I was working there part-time. When I finished, I was working at, for the Florida Health Department. It was the worst fucking job ever. I hated it. And so I quit before I graduated, and I was just leaning on his everlasting hand that I would get a job after I finished, because I felt like it was a government position. I can't speak for everybody, but I just felt like the state had so many people in manager roles that were just not qualified for their job. And when we would talk about, and I say we, meaning like me, my classmates worked at DOH too, we were all in like program manager type roles. All of our supervisors had credentials in like mine had a master's degree in like anthropology, something like that. No experience in health at all. So when we would be talking about these very specific public health, like, using public health jargon that's specific to the field, or even talking about just applying frameworks to programs and considering populations when we're talking about data collection, they just really wouldn't be trying to hear it. And so, you only got to treat me like a fool one time. And I just, either I had nothing to say or I will move on, because there was so much talent that came out of FAMU. So they knew the type of people that they had working there. I mean, there was most of the public health alum, if they stay in Tallahassee, work for the Department of Health, but I just wasn't having that. So I left before, like a month before I graduated. At the same time, again, going back to that relationship building, while I was at DOH, I was managing contracts. One of my contractors was at Florida State in the College of Medicine. So she worked full-time there. She had a contract with us that was another like $75K. So I'm like, on top of your salary, you have this contract position with us that you're maybe working 10 or 12 hours a week. So that was my first insight into what contract work looks like and how you can negotiate those prices or those payments. But that same person, once I told her that I was leaving DOH, she helped me get the faculty. I was in a research faculty role at Florida State, which was like a fancy version of a postdoc. It was amazing. The work that I did was good. It was a great experience. I worked with two white guys that were very interesting people, but I think that's just how it's going to be when you're a talented Black woman working with white men. So that was an interesting experience, like from that aspect. But I did learn so much in that role. And from there, I went on to the University of Central Florida in a tenure track position. So I stayed there, but then I got married and we had that going on, and, we were like, let's go to Atlanta. And I mean, I've been able to totally reinvent my skills and experience into, a contractor who is, knowledgeable in curriculum and instruction design. I'm an insane dissertation advisor and editor. I've edited and advised over 20 dissertations. And then I do faculty development. So I'm actually working with to create programs that train their master's and doctoral students that are interested in faculty positions on what those processes are like, how to get the job, creating those application packets and stuff like that. So you're not just going into it blind or trying to use someone else's, like teaching statement or research statement. Like it really will, these opportunities really challenge students to think about, what it is that you're interested in and what you can offer the institution. I mean, even in addition to that, negotiating your salary or like startup, we don't know how to do that or what that even looks like. So when you get a faculty position and they say, what's your startup request? It's like, I don't know, I need some highlighters. I'm like, no, I'm on 2 MacBooks and an iPad. Like, I need a bunch of stuff. But you can ask for that. We just don't know. So that's, what I've been, kind of how I've branded myself here as like the professor's professor. That's what I do.
Okay, that's awesome. Okay, firstly, and we don't have to get into this a lot right now. You said that you work for your own company. What's your company called?
Insight.
Okay, just making sure that I didn't mess that up on my side. Okay, so that is your company. And did you start that in 2013 as well?
So I started that when I first started doing dissertation editing. That's how that came about. So that was 2000, maybe 15 or 16. I started doing dissertations, and that came from, I want to say 2015. That came from me doing my own dissertation into like the FAMU format, which was, at the time, they hadn't really standardized it. So once I figured it out, then mine became like the blueprint for formatting. But I was the only person that knew how to do it. So for a lot of the people that were coming out of the public health program, they paid me to format their final papers, after they got approved by their committee. So that's kind of how it started. And then, of course, naturally, while formatting, I started reading the papers and I would offer the editing. long story short, somebody told somebody, and I kind of got into the editing process. And then people started asking me earlier on, like, you know, when they were conceptualizing their projects, hey, I'm thinking about this. Is this feasible for a dissertation project? So then I became someone that, like, now people kind of find me at the beginning of their process. So it just depends. Like, I work on either, you know, the dissertation advising kind of, it grew itself into, you know, kind of what it is. But I either work with people who are just getting started, need help conceptualizing, people who are like maybe in the middle and kind of stuck. Their advisor is not that hands-on. They need somebody to, you know, help them be accountable and or assist with their data analysis, which that makes sense. And then my other client would be someone who is already approved and done. They just need their paper edited and formatted. And there are several schools who, like, I am their editor person. So once their students are finished, they do their dissertation defense, they send them to me to do the final, like, review and format to their school standards.
Yeah, that's awesome. And that sounds like you have like a pipeline set up there. And I just think it's also awesome to highlight that you started off by doing your own dissertation and understanding that, okay, this was a good framework, and then the school kind of adopted that, and then you built out from there. Then you did editing, and then you went into like the front end if someone needs help from the beginning into building that out. But I think that's important to highlight that you started at one thing, and then from there, and as you build that expertise and realizing that in doing that one thing, there were other like auxiliary parts or other parts that you also had expertise in that you can help people in is very fundamental. So my first yeah, go ahead, please.
I think in that process though, like, I learned a little bit about a lot of different things. So like I said, I've, you know, read all of these dissertations. You got to understand, like, these are from different disciplines, different topics. So, you know, there's some in organization development, which is a business discipline. So I've done some in that, public health, higher ed, administration and leadership. So it's being able to kind of pull all of that experience into being able to speak to the different types of studies you can do, because I've pretty much seen them all. And, you know, with the editing, you're so engaged into what's being written. I have to understand it too. So I think that's kind of what allowed me to kind of reshape, you know, some of the options that I could, you know, options and services that I could provide, because I was able to learn from all of those experiences.
Okay, I love it. And before I forget, where can people like reach out to you, connect with you for services?
Oh, sure. I have a website. It's www.d as in dog, RBEEJAY, DrBJ.com. My services page will, you know, give you everything you need. So yeah, you can find me there. There's a contact page, schedule a consult, all of that.
Okay, awesome. And I'll be sure to leave that in the description as well as the show notes for anyone that's interested. So going back to you starting off and doing this type of work, what are the big issues or things that you see people need the most most amount of help around dissertations and edits? So what are those things that stand out most of the time?
I think a lot of times it's not having someone who can help you be accountable, because, and it just depends on the institution. But I mean, you gotta think most faculty, especially doctoral faculty, are tenured, so they're not really that invested, you know, in you as an individual. You know, it's part of their job. Yes, they will do it, but as far as the accountability, is kind of on you. You have to create your own timelines, deadlines, and stick to them. So I've become sort of like a ghost dissertation chair, where, you know, I make sure that, you know, they're doing this. Have you emailed that? Did you check this? Don't forget to look up that. So, you know, I become sort of an accountability partner in that process. And I think that's what's missing the most out of it. I think a lot of programs could do well with, like, you know, in undergrad, how you have the advising department that's within the college. I think doctoral programs could do well by having like their own advising team within their programs, that, you know, maybe it's 2 or 3, call them research faculty, who all they do is chair dissertations. So I think we have to reimagine the higher ed space quite a bit before we can really make a lot of steps, because it's been done a certain way for so long, and having doctoral students is part of your role in getting tenure, or requirements, and I'm sorry, in terms of getting tenure. But we have to change that up, because does it really matter if you're not doing that great of a job? Are students really just kind of pushing themselves to the finish line? It doesn't really speak to your credibility as an advisor if you suck, because people can still graduate and you can still be sorry. So it would be, just in my experience, it seems that programs could, bode well from having like a built-in line of chairs to help. And that's all that they do, because you have to think faculty have so many other things to do that, it does become cumbersome having to keep up with this process. But let's say if this is my only job, it's no problem for me to have 3 or 4 students at any given time, because that's the only thing that I have to do. You can really, build your students how you want and really create the best pathways for them to get the jobs that they want post-graduation too. So, what do I know? But I definitely think that's something that schools, could look into to, one, take some of the stress off their current faculty, and 2, to really create these graduates that are career ready when they finish their program.
Yeah, that's great insights. And hopefully schools do that, because it seems like there's a huge gap there if they're like always coming to you and there's a pipeline for you, and that's only like, I'm guessing, a couple of schools as opposed to all the plethora of schools that are out there that aren't offering this type of support. Yeah. And then a little earlier you mentioned something about like faculty positions and how to get a job and negotiating things around that. Would you like to talk on that a little bit more?
So that kind of came about just by me being in my part-time role at TCC. Of course, other students were like, how'd you get that job? How'd you get that job? And even the requirements of that position at the time were still, even now, part-time positions still require like, teaching statement, research statement, your transcripts, cover letter, that type of thing. But you have to be able to speak to higher ed instruction. And if you haven't had that experience, it's kind of hard to talk about it. So in terms of faculty development, what those experiences look like are work. Usually that type of client is a department. So I'll work with like a grad studies program and do a series of workshops for their students that are interested in faculty positions, to help them, one, build out a course. So many have never done it. So build out their own course, build out all of the tools for that course. And then they have to teach at least 2 classes throughout the time that we're working together. So that gives them some experience in, like, one, just speaking in front of a group, and then they have to, among the group, they complete each other's assignments so that they have to grade them too. So there's that component of it too, where, you get to understand like sticking to the rubric and like not being subjective in your grading. And creating those kinds of tools. So I, really encourage students to use like a lot of technology, just because that is what today's student is used to. So even in your online classes, being more creative with your discussion boards, and not just like posing a question, but maybe requiring a search of some sort where students can, use the things that they like to look for an answer, instead of just thinking about, doing a food diary or something like that. What did I eat for breakfast, lunch, dinner? It's like, maybe you could, create something more creative where students can use a different tool. Like I had a food diary project, but it was not just like writing it down. They had to use any mobile app. So Super Tracker is the one that I was using at the time. But, now there's so many. But, they had to use an app and screenshot, and that way it's, again, a little bit more accountability, instead of you just being able to sit down and type, oh, I had a banana for breakfast and da-da-da-da-da. They had to actually use the tool and show it. So there's ways to kind of get around students doing whatever they want to do, because that's just what students do. But, being thoughtful about your assignments and making sure that you're, again, giving students assignments that are skills building. So that's most of kind of what that looks like. And I just reach out to graduate programs that mostly are at HBCU, I care about Black students. So I reach out to their grad studies deans or whoever is an assistant dean, whatever, reach out to them with the idea, here's the budget for it. They say whether or not they can afford it, and we do it. I mean, it's easier than you think, and programs are, I think, a little bit more well-funded than they put on to be, especially when you're talking about student development. I mean, that's important because what students do after graduation reflects on the institution. So you want students who are finishing and getting tenure track positions right out the gate if you're a PhD program. So how can you do that? It's by having people like me who have these different experiences in academia, can talk to people about, you know, what that first year is like as a new professor. How do you get acclimated to, you know, a class of 150 students and you never taught, for things like that. So that's kind of how that goes.
Okay. Yeah. That makes a lot of sense. And as you were saying, a lot of us don't have this kind of information to know how to go about doing it. So thank you for being that resource to a lot of people out there and a lot of programs out there in general. Yeah. Earlier you were going through like your different roles. So you went from the project manager at the Florida Department of Health to research faculty at Florida State University to research associate and assistant professor at the University of Central Florida. And you said you were tenured in this position. How does that process work?
A bunch of paperwork. You have to kind of like just dig back. And I mean, I kind of had to finesse that because I was leaving first, moving. So I was asking for remote work. And they were like, this was before remote work was cool. So they were like, we don't know, So, and I also asked for an early review due to having taught for, at that point, I had already had like 6 years, maybe 5 or 6 years when I got there. So my first year made 7. That second year made 8, which if I was in a full-time position, it would have been time for me to apply. While I was at TCC, I had done several faculty like advancement programs, so I was prepared. So the application process is, a bunch of paperwork. So you have to dig back and find like student reviews and any research project that you worked on, like all of those documents. So again, like it's really important to, one, retain your documents in an organized way. So like all of my teaching stuff is in a folder, all of my research stuff is in a folder, conference presentations, research articles, you know, make sure that you have all that, because essentially you just turn in like a binder this big of your academic career. And that's what it looks like. So, I mean, it's not a difficult process because I'm organized. So I just had to print all the stuff out and put it in a binder and, you know, take it to who it needs to go to. They review it, meet with you, so I guess ask about any gaps, and that's it. So when I got to, the problem with that was when I got to GGC, Georgia Gwinnett College, they did not want to honor that because they don't have a tenure process at all. So that means I had to come in at an assistant professor, which is the entry level for professor. Associate is the second level, and then full professor is the third. Had to come in at assistant level, which also means they didn't want to pay at a tenured level. Furthermore, I didn't have any faculty resources. It was a new program, so they didn't give me anybody to start with. So I was doing everything. Like I didn't have an administrative assistant, nothing. And I guess you'll ask this later about how I ended up leaving, but basically I was like, y'all not paying, I'm working too hard. And that was it. So it was pretty simple. Are you able to pay more? They said no, and I was like, cool, and emailed my resignation. I mean, it was literally nothing more than that. But the process is not difficult, especially when you have a department chair who is really hands-on. I did at the time at UCF. She was wonderful, an Indian woman. And, you know, she knew had been through the process before and had, known the bumps and really helped every year or at the end of every semester. There was a checklist of things that we were supposed to store, which was helpful because, you can make those folders, just put your stuff in it. And again, a transferable skill because I record all of the documents annually for my sorority chapter, and I use that same process. So every month, I send out a checklist to the various individuals that need to send stuff, go ahead and store it. So that way at the end of the year, all I have to do is print everything out. So it's learning and just applying.
Okay, I love that a lot. And then moving from Florida to Georgia, did you go straight into that position, the assistant position at Gwinnett? Because I see that you were a health educator at employee well-being at Georgia Institute of Technology. Was that the first job you got when you moved?
Yep. So when I first moved here, actually, I was the interim director of civic engagement there first. So Jerome Stevens, the tallest gay white dude you will ever meet, and he is so amazing. He is the director of student, dang it, it's Jerome with a G. He's awesome. You can look him up. But the position at the time, it was supposed to be temporary. So the director of civic engagement, who is basically like, her name was Sarah, that's basically the over volunteer work for student organizations. So she was going on maternity leave, so they were hiring a temp at that time. So Jerome, first of all, I was way overqualified for the position. He knew that. But he was like, why, if you want the job, why would I not take advantage of your skills? He's like, if you want the job, you can have it. So I did a phone interview with the two of them. And I started like 2 weeks later, moved to Atlanta, lived with my girlfriend because my husband was still working in Thomasville, Georgia. He's a pharmacist. He went to FAM too. So he was still working in South Georgia. I moved to Atlanta. So I worked in that temporary position for maybe about 9 months. And then that health educator position opened, which was not under Jerome, Dr. Stevens. It was not under him, but it was full time, and the lady was coming back from maternity leave. So I had to switch to something else. But the whole time I was there, and Georgia Tech was a wonderful place to work. They really value their commitment to diversity. I will say, they have a lot of Black and brown people in leadership, women in leadership, which is really cool. So I really enjoy working there. For the right opportunity, I would go back. And I don't say that about a lot of places. But I went into that health educator role. I didn't stay in it long because I ended up getting hired at UNCF, which was amazing because now I'm able to still do contract work with them. And again, another really cool experience because it allows me to network with so many different HBCUs. That way, when I want to contract for some of the opportunities that I just mentioned to you, they already know who I am from when I worked with them at UNCF. So, it was all a snowball effect that I didn't know I needed, at the time. But I went to UNCF, pandemic happened, stayed at UNCF through that summer, and then I got hired at Georgia Gwinnett, stayed there for a year, and now I'm here talking to you.
Okay, awesome. Well, thank you for sharing that trajectory there. So how I can't remember if you said how you got introduced to the UNCF or United Negro College Fund, where you are a data analyst.
There was no introduction. I saw the position was open. Reached out. I mean, I've always wanted to work with HBCUs. I mean, my dream job would be like a dean of grad studies or dean of public health at an HBCU. So, I mean, once I moved to Atlanta, I was only applying at HBCUs here. Georgia Gwinnett came up because they're a minority serving institution, and one of my sorority sisters is in a leadership position there too. So she thought it'd be a good fit, and it was. They just didn't have a lot of the resources that I needed. So I'm not dissing them as a school. They didn't have what I needed to be successful there. But how I found out about UNCF, I think, I probably saw it on LinkedIn, reached out to the center director, and the position that I was inquiring about had been filled, but he said there was another one that was open, which I applied for, reached out to the hiring manager, who she's moved on now, but we still communicate and work together. But she went to FAMU. She was FAMU grad. So I got the interview. I think I just did one interview, an in-person interview, and got hired. And so I started there early part of January. And I mean, like I said, it was a really cool experience because most of what we did was like site visits at HBCUs to just kind of make sure that they were adhering to the procedures that were in some of the research studies that they were working on. So the HBCUs basically they get funded to participate in the research that that UNCF is the funding that they've obtained. So let me back up, because I said that I didn't say that well. So UNCF gets money from, like, let's say, a foundation. From there, that money comes to the research, it's called Frederick B. Patterson Research Institute. That's here in Atlanta. The UNCF that we hear about, like, more so in the media, is located in DC, and that's the fundraising side of it. But the Atlanta office does all the research. So how it starts is there's, money provided from a foundation, they give it to UNCF, it's funneled through to create a research project. Now, there's so much flexibility in what you can do with it. They have maybe like a big picture idea, like we want to collect data on how students are doing through COVID. All right, cool. We put together the project and implement it. So we have the money to hire, like if we need a temporary staff or a contractor, we can hire all the people necessary to pull it off. So I was a data analyst. So I pulled together like all of our reports. If there were internal requests for data, like let's say someone wants to provide, a couple $1 million in scholarships, but they want to know which schools have the most engineering majors from Alabama. I can pull that data. So that was my job there. Once I went to GGC, there was so much work that I had done that was just kind of outstanding. They hired me as a contractor, so I still work for them.
Okay.
So
okay.
I work with the other data analyst who is he was there when I started and is still there. So I still kind of work with him to pretty much do my old job, but just as a contractor, and I get paid more.
Yeah. Awesome. I'm guessing just no benefits, but yeah.
No, but you have to think when you're working full time, just to have a clean number. Let's say you may pay $100 in benefits a month. That's low, but let's use it as an example. That comes out of your check and you don't see it.
Mm-hmm.
So, by having your, when you have to pay your own insurance, you just pay it, it's just another bill. You just pay it monthly. And it's honestly about the same amount because we have private insurance. It's my husband and I pay about the same as I did when I was employed. You just don't see it. So you don't worry about of having to pay a bill, but it works. And the insurance is better because you can select what you want and what you need.
Okay. Awesome. Well, thank you for clarifying that. And then also, like in your story, you're mentioning that so it's assistant professor, associate professor, then tenure track professor. What is no? Did I say it wrong?
Assistant, associate, and then full.
And then full.
You're tenured at associate. So you start as an assistant professor, and every school has different guidelines for how that works. For how long you have until you apply for tenure. Most of the time, it's like 6 or 7 years. So then you apply. Once you get promoted, you become an associate professor. You do that for like another 5 to 7. Apply again, and you get full. After that, you don't have to do anything else. You pretty much can't lose your job.
Okay, awesome. Well, thank you for clarifying that because I'm a little ignorant to the academic world and how all that works. What is you said that you went into Georgia Gwinnett College as an assistant professor, and they weren't willing to pay you like what you were used to, or like a better salary as opposed to like more correlating with your skill sets and what you bring to the table. How much more do associate professors make than assistant professors generally? And I guess you could answer that number-wise, percent-wise, and I'm guessing it's very, very different depending on where
it's different. Yeah, that's a tough question. So I will say an assistant can start around 70, 75, depends on the school. Each, like I said, each school is different, so don't marry the numbers, but I'll say like around 70. If I was applying for a job, I would, as an assistant professor, I would ask for like 75, 80. When I was at UCF, we got merit promotions annually. So let's say now you're at 85. Okay. By the time you apply for tenure, you may be at 90 just based on the incremental raises that you get through, you know, over those 7 years. You don't generally stay at the same amount for that whole time. So I'll make it up again. Let's say an assistant professor is about to apply for tenure and they're making 70. That's low, but by the time they apply, it's usually at least another 10 to 12 on top of that.
Okay.
And then you still are allowed those merit-based increases annually. And you can still do contract work on the side to make more money. Another thing that I did while I was working was grant reviews, which if you have not done that, you can go to HRSA.gov, HRSA.gov, and sign up to be a grant reviewer, and you get paid like $300 a day to review grants. The first time you do it, it's a little, you know, you try to figure it out, but if you have taught, it's not much more different than grading a paper out to make it simple. That's basically what you're doing is grading papers. So I started doing that. So now, you know, I get emails like, oh, you know, we have a grant review coming up on these days. Are you available? I just say yes or no and sign up and do it. So that's how that works. But yeah, I would say it's maybe like a 7 to 8% increase every time you get promoted. But you can it's never a bad idea to, you know, renegotiate. So when I was at Georgia Gwinnett, I was making less than I was at UCF, and I had more responsibility. I took it essentially because of the, again, skill set that I would gain in creating a program and the chair title. That's the only reason I took the job. But what I was told was that the following year, so that would have been this year, that some things would have shaken down and I could, you know, ask for additional money. So of course I did that, and they weren't able to provide that, so I left. But you know, I still learned in that 1 year because I was like a one-woman show. I did everything, so I learned so much in that 1 year time frame than I could have ever learned in 5 to 7 if I was, you know, new coming into an existing program. So, you know, there's benefits and costs to any job, and I mean, that was just one of them, but I wasn't willing to budge on that. So you have to identify like what works for you and your household, and like what you can and can't do, because it's really easy to get stuck in academic positions because it's not like you can, but it's really not cool to just like quit October 3rd. You want to stay the whole semester, at least get through the semester, not leave courses high and dry. So if you don't leave by August, that means you're not leaving until December. If you don't leave by December, that means you're here till at least May, you know? So you just have to think about, can you stick it out for that time? Are you willing to stick it out for that time? So.
Okay. And I think that's like also important. You highlighting that you went to Georgia Gwinnett College because of the program chair, like title that you get, as well as knowing that you'd be able to get all these skill sets, even though you know that you wouldn't be getting paid as much, or like you thought that there was a potential for like that pay increase in the future that didn't come, but regardless, you're able to build up those skill sets and really learn a lot more than you would have in another similar situation, which I think is hugely important to mention as well. Okay, so what was that process like? Because you are the CEO at Insight Consulting and Associates, where you've been for a few years now. So I'm guessing like you quit and you're like, okay, I'm gonna like push more into this, or like how would that thought process go for you?
It was that, and my husband, actually, he owns a business too, so he owns Healthcare Equity Solutions. They do health related programming. So I actually was able to contract under him first, like immediately. Because there was work that, I mean, of course, I do it for him because he's my husband, but I'm like, okay, you got to pay me now. So we had to work out our own contract and like scopes of work, just like any other job. So I have a scope of work for him. I do brand development. So any of that, anything related to like getting minority business designations, looking up grants that are applicable to the programs that they do, that type of stuff. So I do that. So I kind of shifted to that first because I knew that would be able to at least hold me for a little while until I figured out what I was going to do. But during that time, I had to make a plan. So, all right, I need to get my website together. I need to really solidify, like, what are my services going to be? Because I'm a person that knows a little bit of, like I said, I know a little bit about a lot, and I can do a lot of things. So I had to really step back and be like, all right, what do I want to do and what am I going to do? So that's kind of how I, figured it out. I work with, it's a company called Featherlight that does my website, and they do a subscription plan, which is great for somebody who does not have time to learn about like the functionality of, websites, and, you got to learn Wix and buy this and do that. I had to type up the content, of course, but they created the website. Mm-hmm. And then, so there was like, somebody referred me to them. So it was like $199 to start. And then I paid like $60 a month for them just to maintain the site. Like if I ever need anything added, I just email them and they do it. So, and I like that they have it's not contracted. So at any point I can be like, all right, I can log in here myself and make these changes. Like the website is where I need it to be. Hand over the functions of it, and I'm good. So I do like that about them. So they can evolve your website as you evolve as a professional. So I like that. But to figure out what services am I going to provide, and I think eventually they will dwindle because I will, right now I offer three, like I said, it's faculty development, dissertation editing, and then minority like recruitment. So I'm working in that space or in that service. Like I work with organizations who want to recruit more minorities into their organization. So like Bristol Myers Squibb is somebody that I'm in communication with now, and I'll be working with them to recruit from HBCUs. So that means I will be the representative at the career fair or something like that for them. So doing stuff like that. So those are the three things that I'm offering now. The one I'm really trying to build out is that faculty development piece. So like eventually I think the other two kind of like die on their own, or that may be something like that just depends on who it is. I'll do it. But those services will eventually go away. I'll just be known for that one thing.
Okay, that's awesome. And yeah, I'm glad that you had your husband's business that you were able to subcontract for while you quit that job.
And UNCF. So I was still working for them too. So I mean, it really was not a question for me. I was just like, unless we can agree on an amount, like I'm going to leave. And so they do that. And so it's like, well, we can't do this, we can't do that. But at the same time, other people are getting promoted and hired. I'm like, yeah, I can't. So you really have to, I think there's a confidence in being able to say like, this is not worth it for me. It's no matter what kind of experience I'm gaining, like I'm barely getting, the pay is not worth the work that I've done and the work that I know that you're getting from me. So, you're expecting that I'm working 40, 50 hours a week. I'm gonna give you a smooth 10, but I'm gonna give it all I got in that 10. And I'm gonna use your resources to build my business on the side, because these jobs will, they want you to do so much. And especially with, these, young Black millennials, once they find out how much talent we have, it's like, oh, I want you to do this. Oh, you can do that. There's this committee. Oh, I think you'd be great over here. And I'm like, yeah, I don't want to do that. Or I already have enough things going on. Like I can't do everything. And let's not forget, anything that's diversity related, they want you on that. So, you have to know when to be like, yeah, fuck y'all, I'm not doing that. And I mean, it is as simple as that. It's like my worth is way more important than what y'all got going on over here, because they're just going to take your experience, and whenever you leave, it's going to have their name on it and not yours. So you have to really be thoughtful about how you're using your time when you're on someone else's job, because your ideas, your talent becomes theirs when you're gone, and that's it.
Yeah, absolutely. And understanding that a lot of jobs can be very extractive in that way. And like, I'm glad that you had like those other opportunities to kind of like fall back on. And I hope that we all get to that place where we're comfortable saying, no, I don't want to do that. I don't have to do that. And like, peace out kind of thing. So yeah. I appreciate that a lot. And then earlier you touched on academic versus administration, and you wanted to be, knowing that you didn't want to be in academia anymore. Can you talk a little bit about that?
Oh yeah, because I'm not doing that committee work and hiring committees. I'm not doing that. I just don't want to. So I wouldn't, if I were in, like, let's say a dean position, I may teach one class, and that's cool because I do love teaching and my students love me. So I would I'll teach one class or something, just one. But, other than that, I'm skilled on the administrative side. So, making processes that make sense and kind of undoing some of the old school methods that we have, in a lot of our schools, or just, thinking that you have to do things a certain way because they've been done for so long. Like, I want to be in a position to be like, we don't have to do it like that. Like, there's other ways to do things, other more effective and efficient ways to do things. And I think that's, time is so important to me. So I don't want processes that take up too much of people's time if it doesn't have to. If you're just doing it because it always has been that way, that's silly. If there's a more efficient way, we're going to do that. And I want to be in positions to where I can say, yeah, no, we can change this, instead of being, again, in that professor role where I have to adhere to the policies that are already in place, because I'm the one that's going to be like, that's stupid. Why are we doing that? Now I'm in trouble. Like, I want to be able to recognize the problem and implement an effective solution, and not just have to bear with what is already created and being pushed on the processes that are already in place. Like, a lot of stuff just don't have to be like the way that it is. It just doesn't have to exist that way. So, we need, more people who are better at, I know that's my strength. So create documents and tools that fuel efficiency and organization that's my strength. So I fit best in an administrative position. So, when the right role opens, if the time is right, then that's something that I would do. Right now, I'm not really looking for anything. The only place that I would see myself working at, like right now, if I had to go work somewhere, is like Delta and in employee health or something like that. But again, that would just be because of Delta, and the connections would be endless. So if y'all watching, you can I'm available. But I think that would be the only place I could see myself like going to work at right now. Other than that, it would have to be a perfect opportunity, maybe something in like curriculum and instruction for a grad program where I'm, redesigning or, looking at curriculum, making sure that students are getting the experience that they need to get hired after graduation. I would do something like that, especially in PH programs, because so many people are getting them now. Mm-hmm. When you graduate, it's like, well, what experience do you have? And, NPA students, I talked to one of my friends about this, she brings it up quite a bit, Dr. Hall, about students who come out with NPH and they're like, oh, I should be making at least 65, 70K. And it's like, well, why? You don't have any skills. you just have a master's degree. So, I think it's really tapping into students' capabilities, which I think often requires an outside person, because again, faculty, they just don't have that kind of time. Like it's such a demanding role. So it takes an outside person to come in and do workshops, get to learn students, and like you can build, you can find whatever we all have a creative something. Find that piece and help them build that out to make them a standout candidate. Because anybody can teach, do research, and serve on committees. Anybody can do that, but you have to be able to speak to what you bring to the department that's going to be unique or that will make the department stand out. So, being able to help people tap into what that is important, because again, you don't know until you start doing stuff and you're like, oh, I'm really good at this. But this is after you've gotten the job. To get the job, we need to do a better job of ensuring that students are confident and being able to speak to what's unique about them and what they bring to the table. Because the days of going in and filling out a paper application, talking to the manager, that's dead. So, you have to be able to stand out in a cover letter, which, that's a difficult thing to do. So you have to be able to stand out so that you're even just pulled for somebody to talk to you. Even that first conversation may be a video or, something that's computer based, or a skills assessment, something like that, that doesn't speak to your capacity to do a job at all. It's just an assessment. So, there's a lot of layers in these hiring processes that I think are just bullshit, especially for minorities, because we are not trained to do things like that. So I think it knocks us out like right out the gate. Just not having that historical knowledge of how to navigate and, go in and out of these digital processes that have been created by people that do not look like us, that have all of this grand experience in IT and programming. They're creating processes that don't fit the person who's a first generation high school graduate. Like my grandma didn't even go to school. I think she had like a fourth grade education, something like that. So we're not so far removed from people who are not educated. So how do you expect me to play with this assessment that you've created that's gonna, essentially knock me out of the group of people that's gonna get an interview? It's not fair. Honestly, at its core, it's not fair. But I think, we have to be able to, help people, get over some of those technological hurdles that do exist. The main one being getting through that initial review process.
Yeah, I love that. And there's definitely a lot of there that I think is very important, especially a lot of MPHs coming out with no, like just doing coursework and wanting to get jobs and stuff like that. It's like, everyone else is doing coursework. What else have you brought to the table?
What else?
Yeah, what else can you speak to? And I think that's hugely important, and people overlook it. They think, okay, this Masters of Public Health is going to get me where I need to be, but it's that Masters of Public Health with all the other things that you actively put yourself into and intentionally build up this experiences and the networks and everything like that. So thank you for highlighting that. Definitely very important.
Sure.
And then before we move on to the last section of the show, I would like to ask, where would you like to see yourself in the future?
I don't want to do nothing. I want whatever I have going on to be automated to the point where like people can order my class online. And the videos are already prepared. Like it's a self-paced. I want to have a self-paced course that you can download and pay and download at any time. I don't want to do nothing. Like I said, time is so important. I think I want to use the skills now to like build this brand, put myself in this position to be recognized as the person who is, like I said, the professor's professor. That's my goal. And people will come to my website, download my course. I can get paid for speaking engagements, or I can get paid to do the course in person when I feel like it, if I want to. And that's what I want to do. So I could see that in 10 years. I could see that in 3 years. In 10, I could take that experience and go back to, I don't want to say it, but I guess go back to work at some point. Like I said, in a dean role, but I think at that point I would have so much to offer in terms of having been in such versatile spaces. Because like I said, I don't have a traditional path at all. So I think, the next 10 years, I'm going to have done so much more and have so much to bring to the table. I think I'd be great at that point in like a dean position, but I mean, I don't know, because at that point, am I willing to sacrifice the salary for that? Because it's still not going to be amazing. It would be good, but it wouldn't be amazing. And it's going to take more time. And you have to work with people. People managing is probably the worst part. Well, it depends on who you are. For me, people managing is hard. I can manage processes, I can manage paperwork, but people get on my nerves. So you have to know yourself, like what works for you. My husband is great with people. He loves to work with people. I don't. So I mean, not like on a one-on-one type deal. So you have to just know yourself and what you're good at. So for me, if I only have to have like a couple of 15-minute conversations, I can handle that. But every day, all day meetings, that ain't nothing I want to do ever again. So, I think the pandemic has shown us that work can be it can be more flexible. We can do things at different times, and we don't have to be doing things at the same time. Like, you could have sent me these questions and I could have recorded the answers for you. Like, there's so many different ways you can do these things with technology. So I think, that said, people expect you to be available all the time, because now we do most things from a computer. So, it's expected that you're going to respond to an email automatically because your computer's up. I know you saw it, but, we have to do, better about, dictating our time and making sure that we're not allowing ourselves to be like holding these positions, like working too much. It's just not necessary. So I'm not sure how higher ed will evolve. I think, let's say that, I think if it evolves in a way that will still allow me to live the life and have the flexibility that I want, then sure, I could see myself absolutely in a leadership role. But realistically, I think that would have to happen within like the next 5 years. And I will do it for 5 years. And in 10 years, to answer your question, I'm not going to be doing anything. Taking kids to school, and that's it.
I love it. I think it's important to highlight like that time freedom and how important it is, because in life, in so many, we have so many things pulling at us, and like life just continues to go on. And if you don't like put down where your boundaries are, like what you want to do, like you're not going to be able to take your kids to those soccer games or whatever the case might be because of work. And then maybe that doesn't reflect well on what you want for your ideal life and the relationships and this lifestyle you want in general. So I appreciate you sharing that.
Mm-hmm.
And I hope you get to wherever that is you like to be in the near future, because that's awesome.
Yeah, we'll figure it out.
Awesome. All right, so moving on to the Furious Five, the last 5 questions I ask all guests. Number 1.
Okay.
What advice would you give to a student trying to pursue a career in public health?
Don't pursue a career in public health. Pursue a career in something technology-based. So like, yeah, tech is the way to go right now. The public health space, it's full. We full. We got enough people. We full. I think Black students in particular definitely need to be gaining skills in tech, period. I would say don't go into public health.
Fair enough. And I think they like, I talk to a lot of people in tech these days, and I think there's a lot of opportunity and a lot of spaces for people, even like just because when we go to public health, you're thinking, okay, I want to help populations. And I think, as we all know, we're all on our phones now. Digital health is a huge thing. Tech is leading the innovation front.
Tech is it, yes.
Doing a lot of things. So I completely understand. And like to that point, a lot of the things that people learn in like biostats, you can probably learn in a Google certificate around tech.
Oh yeah, for sure.
You can transfer it across. So yeah. Okay, well, thank you for that. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
Make sure that you're organized and you have some solid contacts already. It's not easy working as a consultant, but you have, again, like just really know yourself. Like, I'm not a person that likes to do the same thing for a long time. So honestly, the traditional, like, program manager type position wouldn't work for me because I'm basically doing the same stuff every day. I don't like to do that. So I think for someone who wants to go into, full-time consulting, just know yourself, like be able to have discipline to schedule work time, schedule free time. Like, there's some days that I can't sleep in, but there are other days that I don't have to get up until noon. Like, you have to be really, really disciplined. So I think the biggest thing is just know yourself and have a plan for where you see it going. And again, like, consider that technology piece of how to automate whatever it is that you're doing, because that's a possibility and people like it. And that's where we're at right now. So you have to be able to, evolve.
Yeah, absolutely. Number 3, what's something you are working on improving in your life right now?
Communicating. Like I said, I'm an only child, so I grew up not having to talk to a lot of people. So I think, and being married forces you to like improve your communication quite a bit. So I think the biggest thing is, for me, is improving, just my communication skills. I like to do what I want to do when I want to do it, and that's not feasible it works for me, but of course it does. So, I think communicating more and compromising more. And I think that's just in all spaces, because I probably shouldn't have left some people jobs like that, but they weren't willing to compromise, neither was I. So that's when you hit a brick wall. No, when you have one person who wants to compromise and you don't, that's a problem. So I think that's something that, I'm still learning and growing into, for sure.
Okay, absolutely fair enough. I think we're all in that one. And number 4, professionally, do you recommend anything?
Professionally, yeah, I will. I'll speak to this. The CHES exam. I know even in the group me that we met through, people ask about it all the time. If you have an MPH, you do not need a CHES certification. You have an MPH. That's enough. I would say for people who are in bachelor's programs, go ahead and do it, because it will make you stand out as a bachelor's level candidate. If you already have an MPH, save your money, because it costs to renew it every year. You got to show this and take these classes. Like, it's, at the end of the day, it's not worth it, honestly. So if you already have an MPH, scrap it. Do not take the CHES exam. No one ever has cared about that as a credential, unless you are a bachelor's level. Then that can help you stand out. Like, if you're applying for an entry-level program manager job, I think having that CHES certification helps you. But for MPH, it's never going to do anything extra for you, ever.
Okay, I like that. A little spicy.
It's such a waste. It's such a waste of money.
I think the CPH is even worse.
Oh, and it's so expensive. It's like, why would I need a certification in public health? I have a master in public health. I am the master. I know it. I don't need to be certified. I don't know how these people. I'm gonna make up a certification. Watch.
That's exactly what it is. I feel like.
Yeah, they make up these certifications, and it's like no one. Very rarely. I'll say this, and that way, for listeners, you can confirm it on your own. If you search jobs that are like CHES preferred, literally almost nothing comes up. But if you are a bachelor's level candidate that's applying for, let's say, a master's preferred job, this will, I think, sort of even the playing field to make you more closely comparable to a master's level person. But for a person with an MPH and a CHES, like, that's you're already going to have the preferred credential, if that makes sense. So, you can confirm that on your own, because I'm not trying to diss the CHES. I have it. But I don't need it. Like, it's not necessary for me. I definitely should have done, like, maybe something and like more business related. I think I could have done an additional cert maybe or something like that. But no one ever asked. Like, I have the terminal credential. Like, I know what I'm doing. So for people who have an MPH, that it's enough. Even given so many people have an MPH right now, the CHES is not what's going to make you stand out. It's going to be your experience and who you know.
Yeah, absolutely agree with that. And then last but not least, where can people connect with you?
So you can connect me through my website, www.drbejay.com. On Instagram, same thing, drbejay with 2 underscores. Same thing on Twitter. LinkedIn is Brittny James, DrPH. And I think that's about it. I have Facebook too, but I don't use it that much. But yeah, most of my services and contact information are on my website.
Okay, awesome. And I'll be sure to put that into the description as well as the show notes for anyone that is interested. Definitely connect and reach out if you have any questions or want any help or services help. But thank you so much for coming on, Dr. Brittny James, and sharing your story. I really appreciate it.
Thank you, Omari. I appreciate you having me. This was fun.
Okay, well, I'm glad that you enjoyed, and I hope the listeners enjoyed as well. So housekeeping items. Thank you everyone for watching or listening to this. Be sure to subscribe if you have not subscribed, or if you're on Apple Podcasts, you can hit follow. Like this if you're on YouTube, leave a review. Definitely helps get the show out to other people, as well as sharing it with a friend. That goes a long way. And if you'd like to support in other ways, you can go to thephmillennial.com/support and find different ways to support there, or buymeacoffee.com/thephmillennial. But peace out. See you all next week.